Welcome to the Bernade channel. Thank you for joining us. Today, we'll be discussing a nursing care plan for fluid volume deficit. Nursing diagnosis. Fluid volume deficit. Related to excessive fluid loss, example vomiting, diarrhea, diuresis, hemorrhage, inadequate fluid intake, or altered fluid distribution, example burns, peritonitis. Nursing diagnosis. Fluid volume deficit. Part 2. Evidenced by hypotension, tachycardia, decreased pulse pressure, dry mucous membranes, poor skin turgor, concentrated urine, 30 ml/hr, elevated hematocrit, and thirst. Desired outcomes. 1 patient will display stable vital signs within normal range within 24 hours. 2 patient will demonstrate adequate hydration as evidenced by moist mucous membranes, good skin turgor, and urine output greater than 30 ml/hr within 48 hours. Desired outcomes. Part 2. 3 patient will verbalize understanding of causes of fluid deficit and strategies to maintain fluid balance within 24 hours. 4 patient will show improved lab values, example BUN, creatinine, electrolytes, trending towards normal range within 72 hours. Assessment. 1. Assess vital signs, including orthostatic blood pressure and heart rate, every 1 to 2 hours or as indicated. 2. Evaluate skin turgor, mucous membrane moisture, and capillary refill time every 2 to 4 hours. Assessment. Part 2. 3. Monitor intake and output every shift, including all sources of fluid loss, example urine, emesis, diarrhea, wound drainage. 4. Assess for signs of dehydration, thirst, dizziness, weakness, confusion, or changes in level of consciousness. Assessment. Part 3. 5. Review lab values, electrolytes, BUN, creatinine, hematocrit, and urine-specific gravity. 6. Auscultate lung sounds and assess for presence of edema to rule out fluid overload during rehydration. Nursing interventions. Fluid replacement. 1. Administer 4 fluids as prescribed, monitoring infusion rate and patient's response. 2. Encourage oral fluid intake if permitted, offering preferred fluids and tracking amount consumed. 3. Consider alternative routes of hydration, example subcutaneous fluids, if 4 access is difficult. Nursing interventions. Monitoring and documentation. 1. Maintain accurate intake and output record, including all sources of fluid loss. 2. Weigh patient daily at the same time and on the same scale. 3. Monitor for signs of fluid overload during rehydration, example crackles in lungs, edema. Nursing interventions. Comfort measures. 1. Provide oral care every 2 to 4 hours to relieve dry mouth and promote comfort. 2. Position patient to maximize comfort and minimize dizziness, example semi-Fowler's position. 3. Offer ice chips or frozen fruit if oral intake is restricted. Nursing interventions. Prevention of complications. 1. Implement fall precautions due to potential orthostatic hypotension. 2. Monitor for signs of electrolyte imbalances, example muscle weakness, cardiac arrhythmias. 3. Assess for and promptly report signs of shock, example cool, clammy skin, altered mental status. Nursing interventions. Patient education. 1. Teach patient and family about causes of fluid deficit and importance of maintaining fluid balance. 2. Instruct on signs and symptoms of dehydration to report. 3. Educate on strategies to increase fluid intake, example setting reminders, keeping water easily accessible. Evaluation. 1. Patient's vital signs stabilize within normal range. 2. Patient demonstrates adequate hydration, moist mucous membranes, good skin turgor, urine output greater than 30 ml/hr. 3. Patient verbalizes understanding of fluid balance maintenance. Evaluation. Part 2. 4. Patient's lab values, BUN, creatinine, electrolytes, trend towards normal range. 5. Patient maintains stable weight or shows appropriate weight gain. 6. Patient reports decreased thirst and improved overall well-being. Important notice. This presentation is for informational purposes only. Always contact a medical expert for treatment. Download the Burnaid app for free from the Play Store or App Store for answers to more than 3,000 questions.